A pod, or point of dispensing site, is a mass dispensing site capable of providing medications or vaccinations necessary to protect the general population from biological threats or epidemics.
Dispensing is the most critical of all the strategic national stockpile functions.
Regardless of how efficiently receiving, staging, and storing operations may have been carried out, or how well a distribution plan may have worked. If there is inadequate planning and preparation for mass dispensing, or there is a failure to get pills in people, the overall purpose and mission of the SNS, and ultimately the pod, will not be accomplished.
In our region, dispensing has been designated as a local responsibility. Planning and preparation activities for mass dispensing of medications are carried out by local health departments or the State Department of Health, working with local elected officials and emergency management personnel. Pods are the foundation of a mass dispensing campaign. In an event where mass medication or vaccination is required, the exposed or potentially exposed population will be instructed to report to pre-designated facilities to receive medication. The type of agent used, how it was used, how quickly the agent was identified, the environment, and other factors may impact the amount of time and the number of people who will need to receive medication.
Any one of these factors may require that medications be provided to an area's entire population within a very short period of time. Federal mandate requires us to provide medication to the entire affected population within 48 hours.
A pod is an extremely efficient way to quickly dispense medication or vaccine to a very large community of people. Routine medical care, however, is not provided in a pod, nor is it used to provide shelter, food, or other services. Only individuals who have potentially been exposed to the disease causing the public health emergency will be able to receive antibiotics or vaccine at a pod.
Pods are designed to provide medication that will prevent someone from becoming sick. Persons who are already sick with the disease will not be able to seek treatment at a pod. Those who are ill and require treatment will have to be seen at a clinic or local hospital. The pod launch involves a number of high-level activities. These include:
set up and execute a dispensing operation to serve populations before they become symptomatic. Locate and coordinate the personnel to staff the dispensing operation. Train and organize volunteers to perform dispensing site functions. Isolate symptomatic individuals and arrange to transport them to acute care facilities. And provide the public with information about community efforts to protect them from the threat. To ensure success, state and local officials in our area have already identified several locations throughout the state that may serve as potential pod sites. In the event of an emergency where a pod has been activated, the State Public Health Department will provide information to its community partners, to local television and radio stations, to local newspapers, as well as on their own website, identifying who should go to a pod.
Once a pod has been set up, there are a number of key functions to be performed at the site. These functions include
overseeing and managing the pod, receiving and managing inventory and supplies, protecting the dispensing clinic, the drugs, the volunteers, and the public at the dispensing site, controlling traffic and parking outside the dispensing site, directing patient flow both outside and inside the dispensing clinic, determining which drug a person with contraindications may receive, and dispensing medication and vaccine. All of these various functions are carried out by regional staff and local volunteers.
A pod follows the incident command control structure used by the Department of Homeland Security. This ensures consistency and effectiveness of operations.
Each pod has a pod commander and functions as a single unit command. Pods function independently of each other, but all pod commanders report to the dispensing function lead, who oversees all pods and acts as a liaison between the pods and emergency management. A pod commander has ultimate control to make decisions as needed to ensure success. Core leadership positions in a pod might include a pod commander, operations section manager or clinic manager, logistics section manager, administration section manager, and security director. Basic supplies and materials are stored on-site at a pod to allow activation without assistance.
Additional supplies are requested as needed.
These supplies will include tables, chairs, pod-to-go kits containing items necessary for pod operations, pod signage, and all required pod forms.
Special assistance may be needed for particular groups, including
persons with disabilities, unaccompanied minors, persons with mental challenges, individuals who speak foreign languages, individuals requiring first aid, or security threats. On-site training will review site guidelines and parameters.
Volunteers are critical to the success of a pod. Prior to a public health emergency, volunteers will be assigned to a designated volunteer staging and training area, known as a VISTA.
Vistas are rallying points where volunteers go to receive the medication and materials necessary to work effectively in a pod. Volunteers will be instructed to report to a specific VISTA during a health crisis.
In some counties, volunteers may also report to pre-designated first responder dispensing sites, known as FREDs.
FREDs are facilities separate from public dispensing sites where first responders and their families can report to receive medication and vaccine before the general public. This ensures the health of our volunteers and allows them to remain focused on the tasks at hand.
All those involved are critical to the ultimate success of the pod. At the end of the day, a successful pod is characterized by a number of different factors. These include
clarity, meaning clear mission and eligibility criteria, clear lines of authority, clearly defined responsibilities, and a clearly outlined plan, strong communications between all volunteers at all levels, and finally, effective coordination of staffing and supplies at the pod site.
Events that require a pod are stressful for all involved. This stress can ultimately be alleviated and success achieved through careful planning, training, coordination, and communication.